In our exploration of eye conditions, I know that many people have come across the name or the word cataract, and it's commonly associated with elderly people. But did you know that it actually occurs in children? Yes, you heard me right, and this is what we'll be talking about today. This is the Dr. Tiff Show, and we are putting your health back into your hands. Joining me today is Prof. Chistopher Tinley. He is a professor who's actually working at the Atlantic Eye Center. He's been treating kids for more than 15 years, and he's got vast experience with this condition. Thank you so much for joining me today, Prof. Tinley.
Thanks for the invitation, Tebo.
Okay, so let's go back to basics. So what is the lens of the eye, and how does it become a cataract?
Okay, well, the lens of the eye is a round, clear structure that's situated behind the iris or behind the pupil of the eye. And in certain conditions, the lens can become progressively more and more cloudy, and sometimes even become completely white, like this one. And then light can't enter the eye and people lose vision.
Okay, so basically, and how does the patient actually present if I do this? Can you describe exactly what you're
that's an excellent picture, because you can see that the pupil of the eye, instead of being black, becomes cloudy or becomes white.
Mm-hmm. So other than the white pupil, how does a parent know that the child has a cataract?
It can be very difficult for a parent to realize that her child has got a cataract. That's why children that are very young get screened by pediatricians to check that they have red reflexes and that there's a clear pathway for light entering the eye.
Okay. So basically the pediatrician or the children's doctor, when they check them when they're young, will basically check for this.
They should do. If a cataract gradually progresses over time, then sometimes the children just start losing vision and then start falling over or hurting themselves because they can't see properly.
Okay, so when a child is falling over, for the parents at home and guardians at home, don't take it lightly to say the child is clumsy. There's something happening. You should check the eyes.
Exactly, yeah.
Okay, cool. So now, when the child has got a cataract, can the parent wait, or may this cause problems? Because some kids, we both know, will present, at 8 weeks, or 6 weeks with cataracts. Like, is that too young? Can parents wait? Or must they come in and be like...
Children are very different from adults. So if you've got a makulo or tatumkulu who's got cataracts and milky cloudy pupils, then they can afford to wait, even though they won't be able to see so well. But in children, it's completely different. A cataract in a child is not normal, and it needs to be treated urgently. They need to be seen to immediately, actually.
And can it also be a sign that something dangerous is actually happening in the eye?
It can do, yes. It can mean that there's inflammation or infection in the eye, or even a tumor inside the eye, yes.
So, as we're discussing this, it's coming out, and I think people at home are noticing or realizing that cataracts in children are dangerous. Dangerous in the sense that they could be masking something, and they should not take it lightly. Exactly. Okay, so now the parent comes, brings the child to the hospital. What are we going to do? We say we want to operate. What does that entail? Are there complications? Can you go through that a bit for us?
Sure. So first of all, we need to try and figure out why the cataract is there in the first place. And in some children, cataracts run in families, so it's just unlucky that you're born into a family where there's a genetic predisposition, and their parents or grandparents may have had cataracts from an early age. A lot of children that come to hospital have cataracts because they've had trauma to the eye as well. And some children get cataracts because, as I said, they have infection or inflammation, or they have tumors inside the eye. So it's important for us to work out what the cause is first before we proceed with surgery.
Okay, so now we've established the cause and the child can't see nicely. Now what's the next step following that?
So the next step is a surgical procedure to remove the cloudy lens and then to replace it with a clear plastic lens.
Okay. Yes. And so now as a parent, I'm thinking, will my child now need glasses because of the gogos and the kulus and the the opas, we give them this, or will my child see nicely and that's it for me? by a doctor.
That's also a good question, Tebble, because it very much depends on the family circumstances. So sometimes if we operate on a child with a cataract, we will put a lens in the eye so that the child doesn't have to wear glasses when they're younger, and they might need to wear glasses when they're older. Mm-hmm. Sometimes we put a lens in the child's eye so that they will need to wear glasses when they're young and then grow out of them when they get older.
Okay.
So it all depends on the family circumstances, yes.
All right. So then basically you can't just go there with the preconceived idea that the cataract is out and I'm moving on. You need to be, again, prepared for a journey.
It'll be a long journey that the parents will walk with the doctor, and all of these things will be discussed with the family before the surgery.
So the parents is asking, where can they go to get help if they notice that there's white people or they suspect the child may have a cataract?
You should definitely go to your GP or your day hospital, and then the nurse and the general practitioner will refer you onwards to tertiary centres or to specialist services.
Yeah, and on that note, I'd also like to stress to parents, guardians at home that don't allow someone to become an obstruction to you getting help. If you suspect that your child is having a cataract, you must insist, because remember, your health is in your hands, especially your child's health right now. Okay, so what are your closing thoughts on this topic?
White pupils are a very bad sign and very dangerous, and you must be alerted to the fact that they can be caused by cataracts or by tumors inside the eye. So get help soon.
Yes, thank you. On that note, thank you so much, Prof. Tinley, for joining me today on this episode. It has been quite beneficial and informative.
Thank you, Tebble.
And if you'd like to get more information on this topic, please do write comments below and we're sure to answer you. And if you would like to contact Prof. Tinley directly, we will leave his contact information in the description below. And if you would like to get access to more content such as this, please do like, subscribe, and push the notification button so you will be informed when we upload a new episode. Until next time, take care of yourself, take care of each other, and remember, your health is in your hands. God bless.